there are a lot of our patients who pass away, who die in their natural course, who die during treatment, whom we are not able to save. How does one deal with death as a physician? And what has the death of your patients taught you?
Well, I I think that death is really not in our hands, and it's a part of life, and everything that comes has to go. You see, ultimately, and when somebody is going to come and when somebody is going to go is not really in our control whatsoever. See, having accepted that, I think that the first thing we have to do is to make sure that we do our best for the patient so that there is no negligence, there is no absence of care, there is no absence of availability, there is no absence of investigating or diagnosing when required. We have to be most cautious and most devoted to the treatment so that we know that the best is being done. And it doesn't matter you're doing it with homeopathy or allopathy or Ayurveda or whatever. No pathy is above the patient, you see. So do your best, you see, do your utmost best. And in spite of that, if they pass away, as of course they would sometime, then I think it's very important that we are there for their family to assure them that the best was done for them, because the family goes through a lot of grief and guilt and we should have done that and done that. There is a good friend of mine, a pediatrician, Dr. Mahesh Balsekar, who's very, very, very loved by his patients. And he told me that sometimes, infants they die, even newborns they die, children they die. And that is very, very painful, very, very painful. And he says that when that happens, what he does is he waits for a few days actually, and then he actually goes to their house and sits with them. First of all, grieves with them, and secondly, explains to them what happened, and that what happened despite treatment, or what happened was probably the best for the child, you know, that the child would have been otherwise a vegetable or something like that. So he would really honestly explain the situation. But the very fact that a doctor is going to somebody's house and grieving with them and explaining and talking to them makes all the difference. And the other thing is that we need to be conscious of our own death and what we feel about it. And so, in the wise retreats that I do, we do a death process where we put everybody in their imagination through the experience of their own death. You just lie down, even anybody can do it. Just lie down. Imagine you're going to die in the next 20 minutes or half an hour or 1 hour, whatever. And imagine the scenario, whatever, how old are you, what is happening to you, why are you dying, who's around you, what are they doing, and then start to become aware of your own experience, your feelings, your thoughts. And as usual, as we have described the process of awareness, allow these experience and feelings to come and go and watch it and just be in the space of silence. So, if you are able to deal with your own death while you are still alive, you will be able to deal with the death of others better.